Hello, my name is Katie, and I am a doctor of nursing practice, nurse practitioner with a specialty in family practice. The title of this presentation is APRNs, the answer to the primary care deficit in Medicaid recipients, and APRN stands for Advanced Practice Registered Nurse. This presentation is for the Arkansas State Medicaid Director at the Arkansas Department of Health and Human Services, Dawn Stahl, for the Arkansas Senate Chair for the Medicaid Subcommittee, Senator Ricky Hill, and for Chiquita Brooks, who is the Administrator for the Federal Medicaid Services Leadership. Today, I'm going to focus on why nurse practitioners should be covered and acknowledged as primary care providers for Medicaid recipients. I will also discuss with you why access to primary care is essential for all Medicaid recipients in the country. The problem is that there is a primary care shortage for Medicaid recipients. Primary care access decreases hospitalizations for chronic care patients, avoidable and costly ER visits, and ultimately decreases the overall cost of health care. That advanced practice registered nurses provide comparable primary care to their physician counterparts. This is important to note as increased access to healthcare does not equal a decreased quality in the healthcare received. Recently, in the Arkansas State Legislature, House Bill 1254 became Act 569 on April 5, 2021. This act has authorized Arkansas Medicaid to acknowledge advanced practice registered nurses as primary care providers for Medicaid patients in the state of Arkansas. The impact that this act has includes an increase in access to cost-effective and quality primary care to Arkansans, especially in places where access to primary care is minimal to none, such as rural towns in the state of Arkansas. Research has shown that family nurse practitioners, such as myself, are more likely to provide health care in rural areas compared to primary care physicians. Primary care physicians are more likely to practice in urban areas. I am excited for Medicaid recipients in Arkansas to have the confidence in primary care that is provided by graduate-level prepared nurse practitioners. However, I need your help and support to further advance primary care access across the country to all Medicaid recipients. I ask you all to advocate for a federal act to disseminate barriers for similar acts, such as Act 569 that was implemented in the state of Arkansas, to be implemented at a national level for all Medicaid recipients in the United States. The changes that need to be made include the dissemination of barriers that prevent nurse practitioners from practicing to their full scope of practice and education preparedness. Currently, every state has different laws that affect how advanced practice registered nurses can practice in each state. Barriers that you as policymakers and Medicaid leadership can help to mitigate include resolution of one governing board, the scope of practice laws, and opposition from politically involved physician groups. The American Nurses Association, along with the Institute of Medicine, recommends that only the nursing board govern nurse practitioners. But in 16 states, advanced practice registered nurses are governed by both the medical board and nursing board, which hinders the ability for APRNs to practice independently. To unify Medicaid recipients' access to primary care, a federal law needs to be implemented which allows advanced practice registered nurses to be acknowledged as the primary care provider. I ask that you all advocate for a unified federal law so access to primary care and the overall cost of health care can be decreased. I recommend discussing the Medicaid expansion among colleagues, especially within the Medicaid Committee and Arkansas Department of Health and Human Services, as this could have far-reaching effects for our state and country's healthcare access and healthcare cost. Policy options to consider include federal Medicaid laws that expand fee-for-service to all nurse practitioners, recognize advanced practice registered nurses as primary care providers, and require Medicaid care panels to also include advanced practice registered nurses. What has been tried and failed in the past includes barriers placed by 117th Congress, which limits patient access to quality and cost-effective healthcare provided by advanced practice registered nurses. The barriers enacted by 117th Congress do not align with the research stating that APRNs provide safe, effective care at a decreased cost compared to primary care physicians. By allowing APRNs to be acknowledged as primary care providers for Medicaid, patient access is increased and safety is not compromised. Policy change for APRNs to be acknowledged as primary care providers will ultimately decrease avoidable hospital admissions, increase Medicaid recipients' access to primary care, and it will decrease the cost of healthcare by the Medicaid program in each state. A list of the references I utilized during this presentation. The first one is from the American Nurses Association, the Arkansas State Legislator, and Community Catalyst. Thank you for listening to my presentation, and please let me know if you have any questions.